Hello, everyone, and welcome to another episode of Bro Doc Talk. This episode is titled Pediatrics in the Pandemic, Thoughts from a Black Man. My name is Henry Lewis III, and I'm a residency program coordinator and former pre-med advisor.
Hi, everyone. I'm Dr. Omar Young. Nice to see everyone again. I am a maternal fetal medicine specialist. And today we have a special guest, Dr. Eric Freeman, and I'll let him introduce himself.
Hi, my name is Dr. Eric Freeman. It really is an honor and privilege to be here tonight. I am a general pediatrician in the Richmond, Virginia area. I'm president and physician in chief at Old Dominion Pediatrics, and I'm also clinical associate professor in departments of pediatrics and family medicine and population health at the VCU School of Medicine.
Awesome. Thank you, Dr. Freeman. So tell us a little bit more about yourself. Where are you from? Why did you decide to go into pediatrics?
You know, Henry, I am a native son of Richmond. I was not one who traveled far away from his hometown except for school. So I'm a Richmond native, born and raised. Left here in 94 when I finished high school, went to the College of William and Mary for my undergraduate education and finished there in 1998, and then came home to VCU School of Medicine, where I finished in 2002. I decided to take a true leap of faith. I really didn't want to go that far for residency. I really had my hopes on being where Dr. Young is at UNC, but something in my spirit led me to Oranges and the Sunshine State. And so I went to Cheyenne at the University of Florida Health Science Center, where I did my general pediatrics residency training, and I finished there in 2005. Florida was enough for 3 years. I decided to come back. It was too hot. And so I came on back after some good training and really was in private practice for about 7 years, and then decided that it was time between private practice in the community setting, and also I worked for a hospital-based practice. And truly, I think the stars aligned that came together to open my own practice, which I think has been an aspiration of mine for a very long time. So we opened up Old Dominion Pediatrics in August 20th of 2012. We're about to hit 10 years. Thank you, Lord.
Congratulations.
I started off with 2 employees and probably 4 patients. We are now up to 7 employees and almost 5,100 patients. I have no life, just kidding. I try my best to balance work and personal and professional. I really love giving back. I think there are so many people in Richmond, whether it is personally, professionally, or academically, that have contributed to my success. And I'm always about, as my pastor, the Reverend Dr. Jerome Clayton Ross at Providence Park Baptist Church always says in our charge, is you sacrifice yourself. I think the greatest gift that people can give, regardless of whether you're a physician or any profession, is to serve others. I think it's the greatest way that you can honor yourself and honor God. And so I'm very passionate about being a pediatrician. I do both inpatient and outpatient pediatrics. A lot of people in the community really, some of them stay in their practices. I'm old school. I really wanted to make sure that I kept my inpatient and outpatient skills. So I pretty much see you from the nursery until you leave me. If you get sick, we admit you. If you need to see us in the office, we can handle that. I also am really a passionate advocate for mentoring. I really spent a great deal of time in my clinical faculty role here at VCU School of Medicine, mentoring not only med students, but pre-med students and people aspiring to come into the process. It has really been an honor over the last year to be a part of the admissions committee, to really be in the room where big decisions are made in terms of trying to make sure that we recruit an outstanding class that is also diverse, to make sure that we're trying to impact and mold physicians to strive to go into all avenues of our community. And also, on the undergrad campus, I was very blessed by yourself, Henry, to assume the advisory role for Black Men in Medicine, which was an organization founded by Henry, that I think has really played a significant role in the lives of many men of color on the VCU campus, to inspire them to be motivated and to persevere into the field of medicine. So I have a full plate, but I love every moment of it.
Yes, you do. I mean, I appreciate you taking over as the advisor. I mean, who better than you, especially as a physician, someone connected to VCU and someone so connected to the mission of Black men in medicine. So, I'm appreciative, they're appreciative, and they're going to continue to go very far because of you. So,
I
thank you.
appreciate it.
Yeah.
Thank you.
Yeah.
When you were in these students' shoes, did you have anyone in your experience that looked like you or that had a similar experience to you? And if so, what did that mean to you?
I think one of the biggest things that helped me, I think mentoring is so important. Having someone to look toward as I went through my undergraduate training and my med school training. I can tell you, I think it's very challenging, Omar, as we're trying to get more people, particularly students from underrepresented backgrounds, into medicine. When you don't see somebody like yourself, I think it's hard to imagine yourself in that shoes. I had a lot of faculty mentors here, many African American who nurtured me. I cannot leave this conversation tonight. One of the biggest mentors I had, his name is Thomas Tucker. Mr. Tucker organized and founded the Health Careers Opportunity Program here at the VCU School of Medicine, which lasted for about 35 years. He played a very significant role. There are many African-American physicians in this town that owe a lot of their start to Mr. Tucker in terms of student enrichment, academic preparation. Mr. Tucker was a very important role model for me. Dr. Michelle Whitehurst-Cook, who Henry knows very, very well. I can tell you, I've known Dr. Whitehurst-Cook since I probably have been born. Her family and her family and my family grew up in Lawrenceville, Virginia, where the former St. Paul's College resides. I have had people like Dr. Whitehurst-Cook who have been able to mold me, monitor and check on me and make sure that I had the tools that I needed to succeed. So whether it was faculty, whether it was people in my path, so many summer programs and opportunities where I was able to come in contact with African-American med students, African-American faculty. There are so many physicians of color, Omar, that opened their doors to me in this town of all specialties, not just pediatrics. We're talking peds, internal medicine, OB-GYN, surgery. All of these people had a vested interest in trying to pass the torch to the future generation of Black physicians. And so having that, it gives you a reference point and it gives you an understanding of, okay, if I see this person that looks like me, I know I can get to that level. I also, as Henry can articulate way better than me, there are very few, as he opened Black Men in Medicine, there are very few African-American physicians in this country. There are 5%. When it looks at physicians of color who are men, you're probably going to cut that in half. So when I found those individuals, it really was very refreshing to say, if you can make it, I can do it. And so I try in all of my advisory and mentoring roles to try to pay all of those blessings forward. There's been a lot poured out for me and my cup is full. And so it's time for me to pour out to other individuals. TD Jakes said one time in one of his sermons, at the end of your life, you want to pour your cup out and you want your cup to run empty. So that's the plan. Having those mentors and those people to reference to, relate to, even just to have a listening ear, to have someone to know, to make sure that you are heard, that you are validated, to bounce ideas off. I will say I was best also in my family. I have 2 physicians in my family. My aunt, Dr. Rita Gunner, is a pediatrician who played a great role in what I am and who I am today. I have one aunt who has passed away, Dr. Joan Cummings, who was an obstetrician gynecologist in Petersburg. She has passed away, but I was very blessed to have those 2 outstanding leaders and mentors in my life directly in my family. There are a lot of people that don't have that. And so I feel very fortunate and blessed. And so that's why I think it's so important of all the individuals that have touched my life to pay that back, to pay it forward. So it made a great difference.
Dr. Freeman, do you feel that, you had a lot of great mentorship, both in family and, in medical school, externally? Do you feel that navigating medicine as a Black man was made better because of that?
I believe that having those advisors and people to lean on, I think that any physician, particularly Black physician coming through the process, there are going to be obstacles and hurdles that you're going to have to overcome. I think we all can probably attest to a time when we started our professional careers where people felt like maybe we were not well prepared to do our job. I had a perfect example. When I first was an attending, I had a specialist in the hospital, and I was the primary attending for the patient, but she was consulting on the patient. And she really questioned and kept on second guessing and trying to figure out if I was taking care of my patient in the right way. A lot of times we all deal with microaggressions, I think. And, a lot of people are not going to come out, overtly and say what they feel. A lot of people will do insults and negative feedback to you in a very innocent way. I think we all have to navigate those. I use those people that doubt in my ability or doubt in my strengths as a physician as fuel to be bigger and to be better than that. Not to copy off of Michelle Obama, but I firmly believe when people go low, we stay high. Okay. I think that's what we have to accomplish. I think there are many people who, because there are so few of us, I think very people are surprised when we walk in the room and they say we're a physician. I have had people that I've walked in the room and thought I was the janitor. I have had people to think that I was the associate help. I think it shocks people when sometimes I walk into a room and they find out, oh, I'm Dr. Freeman. I'm the doctor. I'm not anything else. I think you have to use that and just, it is critical for all of us and the people that we mentor. We have to make sure that we instill in ourselves, understand our own self-worth and understand what we are as human individuals and that we are powerful beyond measure. And we just have to know in our spirit that what we're doing is admirable, is achievable, and we are good people. I think that is particularly in college, med school, and my professional career. I have had in my undergraduate years and even in my med school years here, I've had people who have questioned my abilities, felt that, I was probably not going to be successful in a certain course. And in some of those courses, I was probably one of the top grades in that class. There are always people who are going to second guess your abilities. We cannot discount some of the structural obstacles in our society that I think have impeded a higher number of physicians of color. We cannot discount the critical nature of structural racism and discrimination in our world. And I think what we have to do is to continue to persevere beyond that. And the best way that we can do that is to make sure that people like Omar and myself plant seeds for the future. And I think that's what we all attempt to achieve. And all that I want to do is kind of like what we do in Boy Scouts. We just want to leave the world better than what we found it.
I think you said something interesting about self-worth. I think a lot of people in medicine, irrespective of what your background is, have an issue with imposter syndrome. And I think if just what you were saying, if you have a good perception of who you are, where you want to go, what your goals are, and what you want to pursue, then I think getting rid of what someone recently labeled as mind trash is ideal to achieving what you want. And when we, as physicians, are seeing students or residents or fellows of color who are facing challenges of professionalism or not meeting a certain academic standard that may or may not have been appropriately laid out by the education team, or some sort of issue in training or what have you, it's important to have examples of what it means to have achieved what you want to achieve. And having those difficult conversations with someone with whom you can relate, with someone that you can aspire to be, and with someone who may have actually walked in your shoes and can give you guidance on how to navigate a system that isn't necessarily set up for you to be successful.
I couldn't agree more. I think one of the biggest challenges that I see in pre-medical advising, Omar, is getting particularly people that look like me to understand that they can do this. I think a lot of this is having the mental understanding that you can succeed. I think if there's anything that kind of restricts some of the outstanding candidates that I think could go into medical school, is that's the first hurdle they have to come. They have to believe in themselves. And that's something that we're all going to have to continue to work on. Imposter syndrome is real, and it's something that can really be a battle to overcome for many individuals.
And Dr. Freeman, I feel like I love what you just said, because, that coming from someone who is a physician and is also working with pre-med students is key in this kind of success in getting them into medicine, because oftentimes pre-med advisors are individuals who did not become doctors. So they're speaking, really just from their perspective of what they've learned about the process of becoming a doctor. But you as a physician, and you knowing what it actually takes to get there, and you being able to see that potential in the student, I think means a whole lot. And I think we need more of you in the pre-med advising world. So, yeah.
I think it always, there are definitely people, Henry, who are outstanding pre-med advisors that are not in the medical discipline. But I think when you have the opportunity to share your journey, to share your truth, to share your experiences, I think it can only enhance the advising experience. I totally agree.
Mm-hmm. So how did you get into pediatrics in the first place? Like how'd that happen?
That's a really good question. I can tell you, Omar, this probably stems when I first started my process. When I was in elementary school, I won this award for Scholastic Standout. And I don't know why, but I wanted to work in a lab. I wanted to be a laboratory technician. I don't know why. I just thought labs were cool. I think that was in the time of Quincy MD, and he was a pathologist, and also all the labs and the blood and all that. And that's what I wanted to do. This really stems from my Aunt Rita, who is still a practicing pediatrician. She spent her whole career as a public health pediatrician in Fayetteville, North Carolina, in Cumberland County. That was her whole career after she left residency. And I stayed with my aunt one summer and basically shadowed her for like a month. I really went to work with her every day. We came home. I can never thank my aunt enough for that experience. It was the interactions with those children. She actually was using a water pick to clean this kid's ear out, which had a basically impacted cerumen in his ear. And instead of scooping it, water picks work great. And so to see her ability to connect with her families, to see how she impacted the life of a child, I thought it was the coolest thing I had ever seen. I also was so inspired by the diversity that she saw in public health, from people who maybe it would be Spanish speaking or people that had language difficulties, to be able to be so well versed to deliver medicine in a comprehensive way over a spectrum of socioeconomic backgrounds and people from various skills and subsets, I thought was just phenomenal. And I think it was that time that really totally changed my trajectory. I think between seeing my Aunt Rita at her job and also spending some time with my Aunt Joan in Petersburg when she was doing rounds as an OBGYN, we really were inspired to go in pediatrics. I also will say kids, I think, are a big thing in my family. My mom taught fourth grade here in Richmond Public Schools for 34 years. So we either birthed you, we took care of you, or we taught you. And so children and the importance of children really swam around in my family. Pretty much after my Aunt Rita, I think it was pediatrics to the end. I really loved gross anatomy. I had a lot of professors here in med school that really wanted me to go into surgery. I liked surgery, but I can tell you the surgery grind and the surgery hours just weren't for me. And so I went, and I'll be very honest, I felt like for me, I could give a greater impact to my community in primary care. And so that's why we decided to head in that direction. So the surgery bug tried to bite me, but I had on enough insect repellent to block the surgery bug. But pretty much my Aunt Rita, my Aunt Joan, and my mom as an elementary teacher really laid the foundation for a passion to inspire and make a difference in the lives of children.
Did you ever consider, I know you said, primary care is what you felt like you could really make the greatest impact. Did you consider a fellowship? Because I know especially these days, the residents I work with, it's like fellowship, 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 fellowship.
I thought about a fellowship. I'll be very, very honest. I think if I would have chosen a specialty, it probably either would have been cardiology, infectious disease, or probably my number one choice would have been pediatric critical care. I think one of the best rotations that I had in my residency was pediatric ICU. I think it is that rotation that I think really transitions you from a resident to an attending, because it is in the ICU where you really have to take data and very quickly synthesize and make a decision. You don't have all day. If somebody's on the vent, you got to pick, what are you going to do? How are you going to help them ventilate better? If they are septic, you don't have 4 hours. You've got to move and make critical decisions in a very prompt and effective manner. I had a campaign hard to do a pediatric ICU fellowship, but at the end of the day, I think primary care was where my passion was. I also will say, one thing that I think steered me away from fellowship was a lot of times when I send someone to a specialist, I pretty much know what's probably going to happen in terms of the treatment plan. I like to be the Sherlock Holmes. I think it's more cool when you're on the front line diagnosing the illness. And I think having the diversity, I can have an asthmatic come in at 9 a.m. I've got an ulcerative colitis kid that's in the hospital right now. And so being able to look in multiple organ systems, deal with different disorders and diseases from multiple angles, I think it's just the diversity of pathophysiology that I see in my practice that makes primary care so awesome.
I love that.
Nice. So what challenges do you have as a pediatrician?
I think for me, some of the challenges, and I'll answer that question, Omar, as a pediatrician and also as a small business owner, because I think that's where most of the gray hairs in my beard and why I'm bald right now. Okay. I think a lot of times pediatrics can be very challenging because keep in mind, many of our patients are nonverbal. And so it takes much more time and thought to try to analyze and diagnose a small child. And so you really have to have very good communication skills. I think you really have to build rapport with parents, and all parents are not alike. People are going to come from different perspectives, and you have to be able to maneuver and modulate and connect with families, because sometimes it's not just connecting with the patient, but connecting with the parent. I can tell you over the past 17 years of practice, I think there has been a tremendous rise of diversity of clients in pediatrics. I think in many areas of the United States, we are seeing a much more diverse area in clientele, particularly a rapidly rising Latino population. And so making sure that we're able to give comprehensive, compassionate care, but also being able to communicate with our patients is really, really important. I'll be very, very honest. I did 5 years of French. I did not do any Spanish, but I can tell you over 17 years, I'm probably 50% fluent in medical Spanish. I think that's an area that I had to grow to be able to effectively serve our patients. Right now, my practice is probably 60% Latino. And so I have 2 staff members who are Hispanic. But for me and the volume that we have, it was important for me to connect with our patients and make the conscious effort to begin to learn some medical Spanish. I can tell you as a small business owner, it is always challenging with insurance companies. I think trying to balance your overhead, balance your salary, and also making sure that you're keeping revenue in is a constant juggling act, particularly in the middle of a pandemic. There are many colleagues of mine who had small practices that did not survive the pandemic. I can tell you, between 2020 and 2021, I tightened the belt of my practice so tight, I thought I was going to cut off the circulation to my legs, but we made it, God willing. And so for me, I think it is a two-step in terms of not only trying to balance giving effective care, but also making sure from a medical economic standpoint that I can continue my practice in a sustainable manner. And that's always hard for many small practices. There are much larger practices that have hospital-based support or support from major academic centers. And so they've got a little bit more flexibility. But for somebody like me, who's, on the grind, on the hustle on a regular basis, it can be a very delicate dance. But I love what I do. I think when you have passion and purpose for what you do, it's not really work for me. I mean, yeah, I get tired, but, my pastor once said, hell is going to a job every day that you don't like. I think in good times and bad, I have had some tough times in the past 5 years of my life, but I think what has gotten me through some of the vicissitudes of my life is the joy and the caring that I have for my patients. If it wasn't for my patients, sometimes I don't know how I would make it. But I think when you have that passionate loyalty, when people trust you with the lives of their children, I take that as a very reverent responsibility. And so it gets me through the good times and bad.
So from a clinical perspective, whatever you can share, what were some of the challenges you faced during the pandemic?
I think a lot of times it was a very hard time in terms of making sure that we could not only take care of patients, but also keep staff safe. I can tell you, I can't speak for my dear new friend Omar, but COVID was so rampant. I mean, we really had to go into very strict screening protocols to bring people in. We did not, in the height of the pandemic, we were not doing a lot of COVID testing in our practice. We just couldn't take that risk. We struggled with some of our staff decided, yes, they wanted to be vaccinated. Some of them did not. And so we really had to make sure that we were balancing the needs and safety of our staff with the ability to take care of patients. I think also from a clinical standpoint, we really were trying to deal with people were very scared during the pandemic even to come to a doctor's office. I think trying to reassure people that we were taking the necessary safety measures to keep them safe in the office was a huge challenge. I can say I saw some of my numbers go down probably 60 to 70%. There were some days we may not see anybody. I think telehealth was a really unique opportunity to impact and be able to engage families in a sincere way. I can tell you telehealth now, if you don't need an antibiotic, if you don't need something handheld, I think when it comes to minor follow-ups, particularly many of the behavioral health consults that I do, telehealth has been wonderful. And speaking of that, I think if there was anything clinical that came out of the pandemic, I think COVID really helped us to uncover many of the disparities of health among other communities. I think what it did was it ripped the Band-Aid off of some of the things that were not being talked about. There is a significant crisis of mental health in the Black community. I think when we look at infant and maternal mortality in the Black community, we've seen that more and more. And what we're having to do now is constructively try to figure out how we're going to battle that. I think also because of COVID, access to care. Many people in areas of lower socioeconomic background, what would happen with transportation? How would people even get to come and see Omar and myself? I think it wasn't just the diagnosis and illnesses. I think we had to have significant conversations about the accessibility and structure of the entire healthcare system. And I think COVID allowed us to focus and bring light to some of the gaps and what we have to do to be successful moving forward, particularly in communities of color.
Mm. The question is, will those efforts actually be sustainable and reimbursable?
Right.
Stay tuned. Who knows? But I think, meeting patients where they are is, the central tenet of what we learned from the pandemic, right? So a lot of people would poo-poo telemedicine. Like, many years ago, I asked, like, why are we going to another state? Like when I lived elsewhere, when we could just easily put a camera up and talk to patients, like, that don't necessarily need, like, to be examined. Now it's as if it's a brand new thing that just came out of nowhere. But I think it's going to be of benefit, and it's going to realize, like, oh, to actually do telemedicine, people need to have access to quality internet. And so it has other implications beyond, the scope of talking to someone about their, for me, their postpartum depression or their diabetes. Yeah.
I agree with you, Omar, wholeheartedly. I think it's not just about healthcare itself, but the system and the structure of the system. And so I think there are going to be a lot of conversations. And I really think it is going to force our leaders, not only in state, but federal government, to decide how are they going to best serve their citizens. I applaud states here in the United States that have expanded Medicaid. I think that is a great way to provide a safety net. I'm very proud of my Commonwealth for doing that. And I think it has made lives easier, particularly in communities of color and also in many rural areas. So this is beyond race or ethnicity. But if you really think about it, there are many people in rural areas, and if you look at Virginia and also North Carolina, there were many rural hospitals that really were on the verge of collapse if it wasn't for Medicaid expansion. And so not only is it providing better care, but strengthening. I think we all have to look at ways, whether it is legislatively or from a community standpoint, that we can strengthen our nation's healthcare system.
Absolutely. I had a question about, I want to kind of go back a little bit when you talked about how this experience kind of shined a light on mental health, in the pediatric community. Do you feel that, what did you do to prepare yourself for working on mental health in that population? Do you feel that the training that you've had, thus far, prepared you for that? Was there anything additional that you had to do? And moving forward, how do you feel the medical community will be prepared to work with mental health?
That is a very good question, Henry. And so I'm going to give two more shots out on this call. One is I could not leave this call without shouting out Dr. Cheryl Almatine, who is on the child and adolescent psychiatry faculty here at VCU. She is one of my many second mamas. And I spent a great deal of time in my third and fourth year of medical school. I made sure during my psychiatry rotation that we all have to do get out of medical school. I lived at Virginia Treatment Center for Children. I really worked hard to learn and appreciate child psychiatry. And I actually did my acting internship that we have to do fourth year in child psychiatry. So I had a really good background in pediatric mental health, at least enough to sustain myself through my years of practice. There also is a really awesome program that is available to pediatricians and other mental health professionals called the REACH program that the American Academy of Pediatrics is offering now as CME. It is a 2 to 3 day intensive course of major medical health issues, strategy, diagnosis, and management. I did that 3-day course last fall, and it was a great refresher for me. I can tell you that all the primary care specialties, whether you look at pediatrics, family medicine, internal medicine, and even OBGYN, because as Omar can tell you, there are many ladies that use OBGYN for primary care. We are going to see more and more individuals. And unfortunately, there is a huge gap and lack of mental health professionals, psychiatrists, psychologists, counselors, and therapists. And so it really is going to fall upon primary care physicians to really be the marching leaders in terms of identification, treatment, identification, diagnosis, and treatment of mental health disorders. I think COVID only basically unleashed many mental health challenges that were sitting very insidiously under the radar. And I think one of the big things I worried about in pediatrics, and I'm sure Omar could expand on this as an OBGYN specialist, I think we as humans love to socialize. And so when we're on lockdown, I can only speak for pediatrics, but many of these kids really went through some very challenging times. We are talking a generation where there was a critical gap of necessary socialization and interaction in terms of a child's growth and development. And for many children, not being able to go to school was huge for them, particularly in underserved and lower socioeconomic communities. Many of these children were living in situations of physical or emotional abuse. School was a haven for them. And so I can't imagine what some kids went through in the pandemic. There are many children that depended on the free breakfast and free lunch program through the federal government. And so child hunger was something that I know school systems did all that they could to get meal access to children. So whether it's mental health, child hunger, or stress in terms of possible emotional or physical abuse that leads to adverse childhood events, which leads to what we're seeing in terms of the explosion of depression, anxiety, and suicide in children. I can tell you now, I never dreamed that my practice would be so heavily weighted on mental health. But I would say right now, my practice is probably half of my visits are psychology in nature, trying to manage children with ADHD, with depression, very bad depression, anxiety, and the percentage of kids with suicide is rising tremendously. I can tell you, I cannot even probably imagine to count on two hands the number of children I've had to send to the emergency room for acute stabilization, either for a suicide attempt or self-mutilatory behavior. We really are having to go back and really work with children in terms of ensuring a safe social environment, and also really trying to work with these children in terms of their self-esteem, their confidence, and their overall mental wellness. And I don't think it's going to get better anytime soon. We just do all that we can to do the best to help our patients and their families.
That's so important. I didn't set out to go into OBGYN to be a psychiatrist, but I have mental health issues in every single aspect of my practice, be it like if I'm going to talk to someone in ultrasound and I'm honestly just going to give them like, everything's fine. You'll have the patient that says, well, are you sure? Well, what if this is wrong? Then you have to realize that's not normal behavior. That's not normal thinking. And I don't know how you feel, but having to deal with that over the course of weeks, months, years grates on you in your practice of medicine. So I'd be curious to know what your thoughts are on, how do you stay in this game? How do you continue to be cheerful when there's so much chaos around you?
I can tell you, Omar, if there's one thing that I learned in the pandemic, it was the importance of self-care. I have to make sure that I stay healthy physically and emotionally and spiritually in order to be able to give the best to my patients. People that know me know I'm a very strong fan of meditation. The Calm app is my friend. If you need a self-care help, please look up Calm on your iPhone or Samsung device. So I'm going to give Calm some kudos and some free advertising on this call. I also believe in the practice of meditation. And that has become something very, very important for me. One of my dear mentors, Dr. Joanne Braxton, she is an emeritus professor of English and Africana Studies at the College of William and Mary, and she also runs an outstanding nonprofit organization called the Braxton Institute in DC, and they really work on physician resilience, moral injury and meditation. And I've learned a great deal from Dr. Braxton that I have incorporated into my own self-practice. I can tell you in terms of my regular routine, people know me. There are two things that I don't give up: my head shave on Friday evenings and my Saturday of meditation. I actually leave Richmond. I won't tell everybody on this call where I go, but I really like the water. That is something that's been very, very important to me. So I have a very special place off the beaten track where I can go and really I usually spend, I would say, 2 to 3 hours over the weekend of self-reflection and meditation. And I always try to do something for myself. You can't always pour out to everybody else and not recharge. So whether it is through prayer, is through meditation, through other kind of disciplined self-care practices, I make that time for myself. I don't know about you, Omar, but I get to Friday at 4:30. My staff knows I'm pretty much on empty. And so after that, it is my Grande Nitro Vanilla Sweet Cream Cold Brew, a head shave, and then at least 36 hours of peace. You have to do that. I think for us to be sustainable as medical providers, we have to make sure that we have to take care of ourselves to the best of our ability in order to be able to give the best care to our patients.
Absolutely, Dr. Freeman. I can agree no more. So in closing, what advice do you have to future pediatricians or students who are interested in pediatrics?
I think for anyone, and I'll answer that in terms of people wanting to go into medicine and pediatrics. Mm-hmm. I think if you want to go into peds, you've got to love kids. If you don't love kids, pediatrics is not for you. 2, always believe in yourself, believe in your purpose in life, and trust that with all your heart. And 3, surround yourself with individuals that are always going to uplift you to higher and higher levels. I think you can always kind of assess where you're going to be in life by the company you keep. So make sure that company is as critical to you. They should be people that want to lift you up and build you up. I think those are the things that I would leave for people in terms of where to go, whether you want to be a pediatrician, whether you want to be a physician. And last but not least, as the Justice Designate, the Honorable Ketanji Brown Jackson said in her confirmation hearings, always remember, persevere. Never give up. I don't care what you do in life. Persevere.
Thank you very much.
Now I want to be a pediatrician.
Are you going to go back and do training?
Well, this has been a great episode.
Don't worry, Omar. I'll look when you do your C-sections. I'll just wave to you as we take care of the baby. So we'll cross paths. Absolutely.
Well, Dr. Freeman, this has been an amazing conversation, and I am sure that there are, some students out there, residents that have garnered some nugget of wisdom from you. So we thank you for your words this evening.
Omar, thank you so much. And Henry, again, my dear friend and brother, thank you for the opportunity. It's been an honor.
No, thank you. And to the listeners, thank you for tuning in to another episode of Bro Doc Talk, and stay tuned for a new one. Bye-bye.